You might think all laser treatments do the same thing, but they don't. If you don't know the difference, then you could get the wrong treatment. In this video, I'll explain the different types so you can find the best one for you. What are laser treatments for the face? Laser treatments use different types of laser for different goals and what we want to achieve with them. So for example, you could use them for hair removal, resurfacing. You could also look at having vascular treatments with them, so removing sort of like spider veins or even the veins that you get on your legs. You can also have your scars treated with them and lots of other things as well. Simply put, lasers are focused light energy that we use in different ways to treat the skin. What are the types of laser facial treatments? So firstly, and perhaps one of the most commonly known types of laser, is an ablative laser. These come in two different forms most commonly. That's a CO2 laser. CO2 lasers are popularly used for doing deep resurfacing of the skin, often for wrinkles and for scars. You also have erbium laser, and erbium laser is actually what we use here in clinic at Creo. The reason why erbium lasers are becoming more popular is that they are very similar to CO2 lasers in that they treat ablatively, and they are very good for treating fine lines up to deeper lines and scarring as well. And the main benefit of it is that you get a lot less downtime with it. Now let's talk about non-ablative lasers. You first have fractional, that treats such things as acne scars and skin texture. You also have ND-YAG laser, which is one of the lasers that we use here at Creo Clinic. We love this laser because you can use it for tightening the skin and improving the texture. It can also be used for hair removal and is very popular because it can be used on all skin tones. In fact, ND-YAG lasers are so versatile that they can also be used to treat vascular areas, so like little spider veins and things like that. And that brings me to our next type of laser, your vascular and pigmentation treating lasers. So first you have PDL laser, also known as pulse dye laser. And this is great for treating redness of the skin. It's quite a good one because it's strong and very precise, which makes it great for treating things like broken blood vessels or capillaries and rosacea, so anything that's to do with redness. You also have Q-switch lasers. Q-switch lasers are amazing at treating pigmentation, and that's any type of pigmentation from sunspots, even melasma, and you can even use it to remove tattoos. There are loads of different types of specialized lasers, and to name a couple more, there's PicoSure, which is great for treating pigmentation as well, such as tattoo removal. And there's also diode lasers that are very popular for hair removal and skin tightening. What are the benefits of laser treatments for the face? The most beneficial thing about laser treatments for the face is that it's a non-surgical option, which means that you're not having to go under the knife and there'll be a lot less downtime. The other amazing thing is that there's so many lasers out there that it provides a lot of versatility and a lot of choice depending on what you want to treat. No matter what problem you're trying to treat, there's probably a laser out there to help treat it, whether it's anti-aging for the early signs of aging, such as wrinkles and skin laxity. You also have scar treatments, so that's improving the appearance of scars and resurfacing them. You can also treat pigmentation with lasers, so like sun damage and other forms of pigmentation in the skin. You can also use lasers for just rejuvenating your skin in general, and it's in fact a brilliant preventative treatment when it comes to the early signs of aging. So what's the right laser treatment for you? The first thing that we need to ask ourselves is what we're trying to achieve with the laser. Once you've determined what type of skin concern you're trying to treat, then you can consider what your budget is and which laser is right for your skin type. I would highly recommend that you consult with a specialist on this, and they'll be able to help you make the right choice for you and what concern you're trying to treat. Please be aware that if you're pregnant or on particular types of medication, then laser may not be suitable for you. And I highly recommend that you speak about this with whichever specialist is taking care of you. What are the side effects of laser treatment? So the most common side effects that we can expect with laser treatments tend to be pinkness or redness post-treatment. This tends to be completely normal and can also then lead on to skin peeling. You can also get a little bit of swelling and even a bit of like heat coming from the skin after laser treatment, and these again are quite normal. The most important things that you want to be looking out for post-laser treatment are any signs of infection, which if you speak to whoever's been treating you or a specialist, they'll be able to guide you on this. One of the side effects that we really try to avoid with laser but can happen is change in the pigmentation of your skin. Now this tends to not be immediately after treatment but can progressively happen after laser treatment. It's commonly known as post-inflammatory pigmentation, and there are a few ways that you can avoid this from happening. So to minimize risks when it comes to having laser, you ideally want to be prepping your skin in such ways as avoiding being in direct sun exposure before having laser. We often recommend that people be using SPF and that they also use preventative measures to protect against post-inflammatory pigmentation. So using such things as a vitamin C on the face, and there are also other products that can help prevent this. And after treatment, make sure that you follow any aftercare given to you by your laser provider, and be sure to stay out of the sun as much as possible and to make sure that you're wearing a good high-level SPF.